So it's important if you're having symptoms of thyroid eye disease to get a proper diagnosis, because the treatment will be geared towards the thyroid eye disease. And it's important to actually go into an ophthalmologist, discuss your symptoms, and be examined and officially diagnosed with the disease.
It's important to get a proper diagnosis because thyroid eye disease can be confused with other medical conditions, such as hypothyroidism, such as another condition called Cushing's disease. And each one of those conditions has dramatically different treatment. So a proper diagnosis of thyroid eye disease is after proper physical examination and a proper collection of history from a physician. You then get blood work in order to see if you have the autoimmune profile, if you have the antibodies against the thyroid gland. Subsequently, a doctor may choose to do a special type of physical exam with a device called an ophthalmometer to basically see if there's any bulging of the eyes. This may also involve a referral for you to get imaging studies like a CAT scan or an MRI. That's important because that establishes a baseline and establishes whether or not whatever treatment we pursue is being effective.
An ophthalmologist will be able to see something called lid lag, which basically means that your eyelid doesn't cover your eye all the way when you look down. You'll have an eyelid retraction sign, which basically means your upper eyelid is exposing some of the white part of the eye below it. They'll be able to check for extraocular motility deficits so that your eye does not move together, and that's causing the double vision. And they'll also be able to rule out some of the other conditions that can lead to decreased vision or blurry vision or grittiness and sandiness as well.
Diagnosing thyroid disease early is important. It's actually unrecognized. Up to 25% of patients with hyperthyroidism will exhibit some degree of thyroid eye disease. Even if it's asymptomatic, it's important for us to know because it might dramatically change the treatment plan that we offer for your hyperthyroidism. It's important to also diagnose it early because early institution of treatment might change the natural course of the disease and might avoid severe complications like bulging of the eyes, which is typically permanent and may require aggressive interventions like surgery. So earlier diagnosis is better because it allows us to institute earlier interventions.